Pregnancy tests are a profound intersection between biotechnology and daily life, a slender piece of plastic that transforms complex physiological events into an answer that can change the course of someone's future. At the heart of this innovation is the hormone known as human chorionic gonadotropin, or HCG. This hormone, which exists in only trace amounts in non-pregnant individuals, is synthesized in large quantities soon after a fertilized egg finds its home in the uterine lining. Remarkably, HCG functionally communicates the emergence of a new pregnancy, signaling its presence mere days after conception and well before any physical signs manifest. The scientific foundation of pregnancy tests lies in the manner HCG enters the bloodstream and eventually passes into urine. Once implantation takes place, which typically occurs between 6 to 12 days after fertilization, HCG production accelerates rapidly. This hormone's levels double every 2 to 3 days in early pregnancy, quickly reaching concentrations that simple immunoassay-based devices can detect. This swift upward curve is precisely why most home urine tests become effective around the first day of a missed menstrual period. The design of over-the-counter pregnancy tests is both clever and elegantly simple. The plastic stick contains several invisible but critical components that allow it to function reliably outside of laboratory settings. Inside, a user's urine is wicked along designated paths via capillary action, intersecting first with a conjugate pad. This pad houses antibodies tailored to seek out HCG. These antibodies are tagged with colored particles, often microscopic gold or sometimes dyed latex, that remain invisible unless bound to their hormonal target. When urine containing HCG flows over this pad, the hormone binds to the antibodies, and this new compound, now carrying the colored marker, travels further along the membrane. As the mixture moves ahead, it reaches the test line, an area loaded with a second set of stationary antibodies fixed to the nitrocellulose membrane. These immobilized antibodies snap up the HCG antibody complexes, pinning them in place and concentrating the colored particles into a visible line. This is the much-anticipated signal of a positive result. Concurrently, liquid continues to a control line further along the journey. This line validates that the test is functioning by catching excess unbound antibodies, thus confirming that enough sample flowed through the test to be reliable. For some, especially those eager for confirmation at the earliest possible moment, clinical blood tests offer even more precision. By tapping directly into the bloodstream, these assays can spot vanishingly low levels of HCG, sometimes picking up the signal just days after conception. Additionally, laboratory blood tests are capable of quantifying HCG exactly, which can shed light on the progress of the pregnancy or help diagnose certain medical conditions. Despite these advances, the limitations of pregnancy tests cannot be overlooked. Accuracy is highest when tests are taken after a reasonable interval, ideally the first day of a missed period or later. Testing too early or misinterpreting faint lines can result in emotional turmoil. Furthermore, albeit rarely, medical anomalies such as specific cancers or trophoblastic conditions can lead to false positives, emphasizing the importance of confirmatory testing in ambiguous situations. Culturally, the home pregnancy test has become more than just a medical device. It's a personal milestone, often evoking feelings of excitement, anxiety, or anticipation. The journey from laboratory immunoassays to affordable, accurate, and even eco-friendly home tests underscores a remarkable trajectory of scientific ingenuity. Today, ongoing innovations seek to further these goals, introducing digital readouts, enhancing sensitivity, and reducing environmental impact with biodegradable components. Through these advances, pregnancy tests remain emblematic of how biochemistry can empower individuals, transforming microscopic signals into monumental life decisions.